Hello, everyone. Thank you for joining us for this presentation, which is being done by Isabel Adams, that's me, and my colleague Mara West, and it is for the Aboriginal-led CoDesign project to increase access to needle and syringe programs by Aboriginal peoples who inject drugs.
So why research on this topic? Injecting drug use is of increasing concern within the Aboriginal and Torres Strait Islander communities for the following reasons. It has an effect on many aspects of life associated with comorbidities related to alcohol use, homelessness, and poor mental and physical health outcomes, including the increased risk of blood-borne viruses such as HIV and hepatitis C. It influences interpersonal relationships and has far-reaching community effects. Injecting drug use affects a significant proportion of the Aboriginal and Torres Strait Islander population, contributing to many health and social issues. Since 2009 in Australia, the HIV notification rate has been higher in Aboriginal people than in non-Aboriginal Australian-born population. In 2017, in the Aboriginal and Torres Strait Islander population, the rate of newly acquired hepatitis C was 13.7 times higher than in the non-Aboriginal and Torres Strait Islander population. The high rate of hepatitis C may be related to risk behaviours associated with injecting drug use and difficulty in accessing needle and syringe programs. Many Aboriginal people who inject drugs are invisible and do not identify due to the shame, stigma, mistrust of authority and fear of repercussions from government organisations such as police and housing and child protection agencies. Aboriginal people who inject drugs are diverse and there is no typical user. The research timeline involved stage 1, which included planning. This took 6 months from May to October in 2019. Then stage 2 involved project implementation. And this, of course, was interrupted by COVID-19. So it took 10 months from November 2019 to August in 2020. And stage 3 is the research translation, which will go from September to December 2020.
Now, the research methods included the setup of the Aboriginal Advisory Group, the setup of the CoDesign working group, including consumers who assisted with data collection, data analysis and intervention planning. This included the co-development of interview guides and processes, testing of the guide with consumers, recruitment and conducting key informant interviews. The research methods also included conducting qualitative semi-structured face-to-face interviews with Aboriginal people who inject drugs, who access needle syringe program services, needle syringe program staff and volunteers, and key informants. So what does Aboriginal-led CoDesign mean? For the research project to increase access to needle and syringe programs by Aboriginal people who inject drugs, it means to have an Aboriginal advisory group who provide an appropriate Aboriginal voice to lead the project to ensure a culturally sensitive and secure approach, and for them to be involved in the design of the project in collaboration with the research team. So members of the Aboriginal Advisory Group consisted of 6 members, 4 of whom are elders of diverse ages and 2 younger people. All members have extensive knowledge, understanding and experience of historical and contemporary issues that are faced by the diverse Aboriginal communities and populations, including illicit drug use and have comprehensive experience and skills as researchers. The key role of the Aboriginal Advisory Group is to, or was to, I should say, guide the project processes to enable the involvement of Aboriginal organisations and the participation of Aboriginal people in the target group, to provide direction on cultural safety and security approaches for the project, to assist in the engagement of Aboriginal researchers and research assistants, and to provide comment and feedback on the research materials and data collection. So what was the assistance given by the Aboriginal Advisory Group? They approved the engagement of an Aboriginal researcher and research assistant for the research project. They suggested processes to identify and involve potential Aboriginal community organisations. So of those Aboriginal community organisations, 12 were identified and contacted by the Aboriginal researcher for their possible involvement in the project in relation to Aboriginal people who inject drugs, who do not access the services and are difficult to reach. 5 of the Aboriginal key stakeholders from these organisations participated and were interviewed. A few organisations provided information on the research project to their clients, although no potential Aboriginal participants contacted the research team to participate. And comments by organisations indicate that Aboriginal people who use needles and syringes are very reluctant to be identified due to shame, stigma, and mistrust of authority and agency repercussions, and generally will not participate in research about this issue, even when an incentive payment is offered. The Aboriginal Advisory Group also attended meetings of larger research project design group. So thank you for listening to this presentation. And if you would like to contact us to find out more about what the advisory group did, here are our contact emails. Thank you very much. Oh, Emma.